What's up, Kosova? This is Coach Q. I'm your host for the upcoming podcast called Never the Right Time. We are on every Tuesdays, 11:30 a.m. to 12:30 p.m. 103.5, 105.5 Urban FM. We're going to be talking all things around health, fitness, lifestyle. Please check us out. Here's a quick shout out to our sponsors, 5-Star Fitness and Onze Recovery. 5-Star Fitness. Goes without saying, we need to be active nowadays. It's a must. And to help with this, 5-Star Fitness, with locations across the country, has established itself as the place to pursue your fitness goals. Now, Onze Recovery, let's talk about stress from daily life, leaving us depleted, in need of that reboot. Onze Recovery offers different types of therapies to help you recover from the daily stresses, especially when we are limited with time. Thank you for tuning in to 103.5 or 105.5 FM, Urban FM that is. This is your host for It's Never the Right Time, Kyuta Klinger, or aka Coach Q for those that know me through the gym and also like train together. I'm here today with Mustafë. I'm actually a patient of his. He is, he's certainly a physiotherapist. He's much more than that. And we're going to talk all things about physiotherapy as well as, let's say, the trainer, personal trainer physio relationship. But I'd like for him to introduce himself briefly, and then also sort of who you are, what you do, where you do it. And then we can kind of dive into some of the topics.
First of all, thank you for this invitation. Okay, I'm Mustafë Januzaj. I'm a physiotherapist. I work here in Kosovo, in Fushe Kosovë, a city near Pristina here. And I do some kind of physiotherapy that it's more than called osteopathy, okay? Mm-hmm. It's a new form of application of manual therapy. So we do some much more exams that we did before. So we have to take some response from the body that says more about the body and the problems. Okay. Mm-hmm. So we try to reach everything that body has to tell us. So this is kind of more interesting for the body. Okay.
Because I think physiotherapy, people know about it, or at least they have an idea where it's, I think for the average person, it's, okay, I'm going to go see someone to get a massage because there is, let's say, an issue, an injury, or some kind of pain, right?
Yeah.
For the average person. Now, within that, there's many approaches to physiotherapy as well, right?
Yes,
and then you also mentioned osteopathy. So maybe if it's not too much, to kind of explain a little bit of the different practices that maybe people have come across, because also I think in different countries different methods are maybe more popular than not, but at least maybe in Kosovo, sort of what is available maybe.
How to say, when we first mention physiotherapy, okay, for all other people, they remember massage, okay, because it's a kind of treatment, okay, that we use most, okay? Mm-hmm. But osteopathy, acupuncture, and a lot of other things that we can use in physiotherapy together to get more and better results, okay? So I use osteopathy more because I studied for that, okay? Mm-hmm. 3 years after my bachelor degree, okay? And osteopathy gives you all the answers that you need from the body.
Okay.
You can use some manual treatment that is not used in massage. Okay. You can use some points that you can relax or inhibit or stimulate some nerves that goes all around the body and gets a very, very good response from the body. Sometimes body tries to tell us something more than pain or more than dizziness or something like that. Mm-hmm. And we try to understand that. When we work, we try to reach those answers and to take the response from the body. Okay, so osteopathy gives you a nice form for the body. Body likes osteopathy, and physiotherapy in kind of long term.
Because from my experience, at least before coming to you, I visited so throughout, let's say, whatever sport and also kind of like the fitness journey that I've been walking. I've had plenty of different injuries, nothing serious, fortunately. But my experience with physiotherapists have been predominantly where they would, it is kind of a deep tissue sports massage type approach, which I think is quite the classical and what a lot of people have in the back of their mind. I have in London also experienced dry needling.
Yes.
So trigger point therapy, right?
Yes.
Where it's really slightly different from acupuncture, where you're not going to the meridians.
Dry needling uses trigger points, so you can stitch there the needling, okay, and then you reach a neurophysiologic effect from the trigger point to the brain. So the brain releases some hormones to release that piece of muscle. Okay, let's say it like that. Okay, acupuncture uses a different form to meridians of the body.
Yeah.
So there are some points, some specific points that you have to put. It's a different school, okay, from acupuncture and dry needling.
And from previous experience, probably I'd say yes. Okay, so most physiotherapists, and including yourself, of course, and I guess even trainers for that matter, like you take a step back when someone new comes to you, you have to go through an assessment, right? It has to, because otherwise you're kind of going in blind. Like someone will say, oh, I have a shoulder injury or a local kind of pain or symptom. Yeah. And okay, some form of assessment is done. But from my personal experience, especially throughout, like, let's say in Switzerland and Japan, as well as in the UK, yes, an assessment is done, but then the actual treatment, and this is where I found your approach very interesting, is that it's very local in the end. So if I had, let's say, an impingement in my shoulder or so, then yes, we're doing some, let's say, range of motion tests, these kind of things. Also, maybe the neurological kind of.
Yes.
But then when the actual treatment starts, it's sort of maybe trigger point around the neck, shoulder, and let's say maybe the back, upper back. It's still local and at best maybe regional, where, for you. And then, one topic that I really want to discuss also is about the fascia, because that's also something that you really look into.
I wanted to go there because we have a lot of problems, for example, for the shoulder. Okay, I will try to explain this for one articulation of one joint, okay, and then some of us, when we train or when we work something, we have tight muscles in our back or in our shoulders, and the first thing that goes in our mind is that there is an impingement or there is a tightness in our muscles, and because we worked out or something, like we have a bad position in work or something like that. Sometimes it can be, for example, for the right it can be a problem with our liver, okay? Because the fascia is a structure in our body that covers all over the body, okay? So if there's a problem in the fascia, for example, in liver, okay, or structures around the liver, so it can affect our shoulder. For example, it can affect its movements or its place in the relaxation place, and there can be an impingement. So when we try to work only with physiotherapy, we treat the symptom. Okay, we have pain, we treat pain with dry needling, acupuncture, or something like that. But when we do an assessment of osteopathy, we look all over the body. What are the odds, or what are the chances that the problem is not coming from the local place, but is coming from the different places? Okay, we have to try to reach much more answers from the body. So this is called an osteopathy test that is done by hearing the fascia. Okay, and that is the most interesting thing about the osteopathy. You have to reach that level, okay, that you can hear the movements of fascia. Fascia is a structure that moves 24 hours a day, okay? Like pulse. Pulse is a pulsing sound, okay?
Yeah.
That you can try and you can listen. Fascia is a movement that if you do a good training on hearing fascia, you can reach more knowledge about the body. Because if the fascia is moving on one side more fast, okay, and the other side is more slowly, so that other side that is moving more fast is telling us that there's an emergency of that structure that is representing, okay?
Yeah.
So then we go in those structures, we try to reach them, to hear them, to touch them, to palpate them, and then whatever the answer is, we can say to the patient, okay?
Yeah, because you bring up something, because the body is so resilient, right? And we underestimate actually how smart or how strong the body is.
Yeah.
And you bring up the point where, again, like, yes, there's this if we use the shoulder example, there's this local symptom, right? But through the osteopathic tests, you're looking at the body, like collecting as much data information as possible, right?
Yes.
And somewhere along the lines, because of sort of probably that person's lifestyle and sort of movement habits and so forth, there is some more than likely a compensation that has happened, right? Where until the moment of that maybe injury or that the movement that causes the final, like, crosses that pain threshold, already there has been probably steps along the way. It wasn't something that happened overnight.
Yes.
Right?
Yes. The first question for my patients, it's always when they say, for example, my shoulder hurts or something like that, I say to them, did you had any injury in your shoulder? And they say, no, I don't think, or I don't remember. And this is a point that you have to do a very good examination there, okay? You just don't go only local, but you have to reach all over the body, because when you don't remember that you hurt yourself somewhere, so maybe body is trying to tell you something about anything else in the body, okay? So, for example, I want to tell you a story with one patient of mine that I had about 6 months ago, okay? They come in my clinic, and a woman about around 40s, okay? She comes with a lot of pain in her back, okay? Lower back, sacroiliac joints. And she lays down, and I do an assessment. Then I go and palpate the abdomen. I hear the fascia. I do the osteopathic test, and all the results says me that there is a visceral problem, a big visceral problem.
So it's quite deep.
Organ, yes. Yeah. It's a problem of organ that is causing the pain in the back. Okay? And I say to her, have you been to the gynecologist? She says yes. I say, when? 2 years ago. And I say to her, okay, first of all, you have to go and to make an ultrasound of your abdomen, to the gynecologist, and then you come to me if he says or she says it's good there. She says, no, I want to make the massage here. First we mention, okay? I want to make the massage and to release the pain, and when I have time, I will go there. And I insist. No, I say to the lady, no, you have to go to the gynecologist, and then you have to come here. When she goes there, she calls me after 2 hours of tests and ultrasound, and she says, oh, they are thinking that is stage 3 of tumor of ovarian
cancer.
Yes.
Oh, no. Okay.
So this is the reason why we should do very specific tests and a full assessment of the body, because if I did the mistake and get that lady in the table of massage and do thermotherapy and something like that, it will cause her more likely to death than to go well.
So couple questions there. For example, because, again, and I'm also very curious about the sounds that fascia make, because clearly you know, being a patient of yours, you've heard my fascia.
Yeah.
I don't hear my own fascia, so,
You
I do wonder
you can hear mine if you train.
well, I do want to. I'm curious, like, what is it saying? But I guess through your experience and also the studies that you've gone through, then I guess depending on sort of how the fascia reacts to sort of your testing, then there I would imagine there is a bit of a hierarchy of sort of like, because one thing could lead to the other, right? And ultimately, maybe there is one source that is causing, or there could be multiple things happening, right?
It could be 2, 4, 5 sources. But we go always to the big source. Okay.
Sure.
We try to, to prevent other problems. And we go when we release the first source of the problem, then we go to the second and something like that. Okay. But we have to be very intelligent how we assess to the body. Okay. Sometimes we hear something that the person doesn't like to hear or something like that. Okay.
Sure.
Okay. And we have to try to communicate that to the patient, sometimes to just know for ourselves, to work on it and let it go. Okay. We have some kind of these problems, but
and then I guess there is also, depending on what you find out, there are things that, okay, we need to treat this first, right?
Yes.
And it might not even be what the patient had come in for.
Yes, and here we find a misunderstanding by the patient sometimes, okay? Sometimes because when I say, for example, they come with pain in their back, okay? And I say to them, no, I have to release your diaphragm first, your pelvic floor first muscles, okay, your transverse abdominal muscles and something like that. They are not used to hear that, and they say, no, I have back pain, you have to treat my back pain, not here.
But it's coming from somewhere else,
I can say this is from science, okay, that are telling that about 60 to 70% of the problems of our back are coming from our abdomen here, from organs, fascias, muscles, from the abdomen. So we have to reach all over the body. We have to. I say to my patients, we have to look on back, on sides, and everything. So then we can work together.
I think that's also a bit of a symptom of today's kind of where we're looking for instant gratification, right? We want an immediate, like, if exercise was a pill, then everyone would take it because it's easier, right?
Yes.
And in terms of where, I mean, lower back pain is, I think, between both of our professions, like, it's so common, right?
Yes.
But I think what people, I think, are always after is, and then maybe this is also part of the educational piece that needs to happen, where, you know, they think like, oh, I want that massage on the back,
because
right?
it's
like
relaxing,
a band-aid, right? But then that isn't solving what is causing ultimately
the problem. I think, how to say, or more fast you can reach to resolve the problem with osteopathy or this kind of treatment than if you do a massage every week. Okay, a massage every week, it relaxes you. It does that your pain can go sort of, okay, but it comes back. When you treat the source of the pain, then you have resolved all the problems. Okay, this is difficult to say and difficult to work, but it comes more easier to the big results. Okay.
Yeah, I think that's definitely like something that I can appreciate as well, where often, from my perspective as a trainer, a lot of times, okay, the way I see injuries now, and previously when I was a much younger trainer, it wasn't the case, but now more and more, I feel that, and I'm probably generalizing a little too much possibly, but two types of injuries, where one is an accident that one cannot avoid, like blunt force trauma, like a car accident, the force nothing you can do about it.
Yeah, of course.
And then the second, where it's most common, especially in the gym or through sports, is at that moment, that muscle or the tissue, let's say, in that certain movement angle or pressure could not withstand the load.
Yeah.
The stress.
Of course.
And then
it
an injury happened. So
yes.
ultimately, it becomes a problem of strength. Right. So then the underlying cause is we need to strengthen whatever it is, whether it's from the joint, the capsule, or the tendons, the muscle. But I think where it gets a little bit confusing is sort of, I think what I see, and then this is also sort of like where a lot of people think of what mobility training is, for example, or stretching is also kind of sometimes confused, where
Yes.
they injure themselves somehow, and then maybe they, of course, maybe they be smart and they don't use that part, they avoid it, and then they try to do a little bit of like stretching or maybe some band work, and then kind of go back to what they were doing, right?
Yeah.
Versus really trying to kind of understand, okay, I'm weak, maybe my, if it was a bench press, maybe my shoulders are not meant to do that certain bench press because of how much space I have accessible, for example. And so rather than kind of really looking at the shoulder and the chest and kind of, how much, can I move it actually?
Yeah.
I'm just going to maybe start light again and just keep going.
Without any tests of your mobility or something like that. Okay.
And then it's sort of, I'm going to go see, Mustafë or another physio. And what I'm going to get is sort of a Band-Aid, or well, not say, you would certainly not offer this, but like sort of, I get a good massage, I feel good, but then I have to go back again, or it becomes a recurring issue, right?
Yes, this is an issue that I don't want to make our people or our patients to do that, because we want to resolve all the problem, not to treat the problem, and we can do it more easily. Okay, if I do that assessment and I say to a person that your humeral scapular joint is not doing quite good in external rotation or internal rotation, so I can say to him some different exercise that he or she can reach the full movement of the joint, and then go training and do everything that he or she wants. I want to mention something, that every muscle that is tight, it's a kind of way of body saying that that muscle is weak. Okay, so when we try to make a good training, okay, we have to hear our body first. We have to hear our body first, what our body is saying. And when we know some kind of answers, we can know to who we look to reach those resolves of problems. Okay, I can go to Qta, okay, if I want more exercise and I want to look good and healthy and something like that. But if I have tightness in my muscles, I have to go to a physiotherapist and to see if there is a lack of mobility, is there is a compensation from the other part of the body, or if there is a old injury there that I have to resolve that trauma from that part of the body and then to start exercising, or there is something that body try to say us. For example, we have calcificate in our muscles, okay, that is a kind of form that our body is saying that your joint is moving more than it should be. So it has to make something that has to stop your movement. So one kind of form of that stopping the movement, it's like placing calcificate in our tendons of muscles and something that can cause then rupture of the muscle or rupture of tendon of muscles. We hear a lot of them. Okay.
You bring up, so in terms of, yes, when you, in terms of, again, going back to that shoulder example of like, okay, can it externally rotate enough? Again, gathering that assessment becomes even more important, right? Yes. And I think that whether it is the therapist or even the trainer, right? It has to start with that. Yeah. And I do find that a lot of times actually there's not much of an assessment that goes on the trainer side, which is kind of unfortunate, right? And then it's sort of like, as an industry, it's so easy to slip into kind of, okay, this is the program because sort of this is what I like to do and what I find interesting and fun, and it worked for me up to let's say a certain extent, so I'm gonna have my clients do the same, kind of, right?
Yes.
But I know, like, our bodies, everyone is different.
Yes, of course.
And therefore a minimum of assessment kind of needs to be done, to whether it's already a movement pattern screen, or let's say if you can afford to go into a little bit more detail, like joint by joint, in terms of like the spine, okay, how much flexion extension do we have, and then the other joints we're looking at more rotation, for example.
Yes.
To see, and then also understanding the context, right? What does this person do? For example, like I think we share a common client, for example, Kiana.
Yeah.
Shout out Kiana. She's in Finland right now. She's a skier. Her needs, what her body needs to do, is very different than what the average person needs. An athlete, and you treat a lot of athletes as well, right?
Yes.
The demand that their body needs, right?
It's very different what body needs in some kind of other sports, or then from sport to sport. And this is the reason why we have, and we should, me and you and other health providers, because you are a health provider too, and we have to hear the client, okay, and then we have to tell the truth about the client, okay. We have to tell him or her that we have to go in this project with you, okay, from the assessment and something like that. I have some patients, for example, that I say to them, oh, you have to go in yoga or in Pilates, because the parasympathetic nervous system is more higher, and they have to go with more breathing exercise and more slowly exercise, more stretching exercise. But if you take a client or a patient that has sympathetic nervous system more high, okay, that has more adrenaline, and if you put that person to do yoga or Pilates, it's nonsense, okay. You have to put it in some more advanced and more energetic exercise. You have to put a lot of different exercises to him, and not to that other person that has parasympathetic nervous system more higher, okay. We have differences on that. So we have to see through the patient that, okay. We have to see that.
Ultimately, that person's context is I mean, super important to understand, right? Because then, in order to deliver something truly, let's say, tailored for that, because again, myself, but even more so, you don't just offer a standard treatment, right? Like you do the assessment, and then you have an idea of what needs to be done for each person, right? So
specific for the person and for the problem of the person. You have to look that.
And I think, like, you bring up sort of one of the things that I wanted to also chat with you is sort of again, every country is going to be different, and it's ultimately up to sort of the different health practitioners kind of working together, right? But sort of, I remember, because we share a couple of patients and clients in common, and so it's a no-brainer for me that, like, the client is the focus, right? Ultimately. And so when finding out that, okay, Mustafë's treating some of my clients, then of course it's gonna be normal, or like I would absolutely ask for also your opinion of, like, okay, lower back issue for one patient, or let's say another client, like, we're struggling with the shoulder, like, you have your perspective, that is going to be much more from a medical perspective than I am, than myself, right? And sort of kind of combining that, your opinion, to then incorporate that into my programming. It's like a win-win for the client, right?
Of course, always.
But I do remember kind of when we first started to kind of collaborate and talk about our common clients, patients, whatever you want to call it, like, you were quite surprised, right? Because it hasn't really, because you work with a lot of other people.
I was not used to hear that from other trainers. Okay, some of the trainers, yes, but a lot of them no. Okay, so it is, yes, it's a win-win for our clients, or my patient and your client, because when we try to collaborate with each other, so we make it for the client.
Yeah.
Okay, for the health of that client. So, yes, I was surprised with you. So thank you for surprising me.
well, I thought it's because also like the cardinal rule for myself, and I think any health practitioner, it's do no harm.
Yeah.
Right.
The first law of.
Yeah, and regardless, just because I'm a trainer, that's maybe not considered by a lot as a health practitioner, but I'm in the business of preventative healthcare, essentially, right? Of course. And people come to me with various problems, and I try to help them find a solution together. But ultimately, they cannot be worse than they started. Right. So, in terms of the exercise selection, or in terms of coming together, putting together the program, that is quite a sensitive, and it's not 100% right always. It's a bit of trial and error. I need to figure out, and sort of, I think maybe you can relate to, where you attempt a little bit of treatment, you listen to the fascia or see what the feedback is, and then, okay, maybe we need to do something else, right?
Yes. For example, I want to mention only one thing that is funny, okay?
Yeah.
Because one patient of mine and client of yours, okay, she comes with a lot of pain in her back, and I do some visceral assessment there, and I had to move some vertebrae, okay, for more mobility, and she says to me, "Now what?" I say to her, "Now go to Cuta." This is when what I could help to you. Now Cuta is going to help you to reach all the movement there and something like that, because we have to share, and we have to do only what we do the best. And if we know that somebody does something that is best for our client or our patient, we have to do a reference for that. Okay.
Because worst case scenario is you could do all the treatment and get your patients to a certain level, but then if I completely disregard that and we're like, all right, we're gonna just do this, it could completely let's say set your treatment back as well, right?
It could lose all
the effects, right?
The results and effects, yes. But yes, if we do an good understanding each other, okay, the patient is the winner.
Yeah,
always. Okay, me and you and him and her is good, but the patient is the winner in this case. So we have to share our opinions. Sometimes, a lot of time, I called you for a patient and I said to you, please, can you do this, okay? Or then you called me and you said, I saw this, and can you work on this?
Mm-hmm.
This is good idea.
Yeah.
You are not trying to teach me my profession. You are just trying to open my eyes more, because I see that patient only for 50 minutes to 20 minutes, okay, while I'm doing the assessment, and you are seeing that person about 1 hour training, and you see problems on that.
And it could even just be a simple kind of observation where I have a question. Do you see the same thing as I do? Right?
Of course.
And sometimes it is a bit like sort of almost, I don't know if scary is the right word, but I don't want to just guess, right? And then I just continue with a certain exercise, and then actually it causes
to not be sure that this is the good thing or the right thing for the patient or client. But I think that when we share our information for our clients, or we don't do, or we do just less mistakes. Okay.
Yeah,
of course. And this is the best form that we can do for our clients and our patients.
And I think it just also goes to in terms of the world of fitness, health in general, it is moving so fast, right?
Yeah.
One will never have all the answers, right? And so it's sort of why not collaborate and be able to kind of cover a little bit more ground by like coming together, right? And then like as we've been saying, like the patient benefits the most, right?
Yeah,
so
of course.
I wanted to just switch a little bit of direction and ask in terms of how you decided to become a therapist.
Oh, that's an interesting story. I always wanted to be a physiotherapist.
Okay.
I go to the medical school of physiotherapy in middle school. Then I go to the University of Pristina, studying physiotherapy, and I always like to know more about body. When I was in middle school, I was asking my professors there then, you are saying that it can come pain in our neck, and you are saying that is tight muscles, but what causes tight muscles? And the answers was very poor from that kind of science, and I was not like very happy from the answers of my profession. Not because they were on knowledge or something like that, but they had some kind of that protocol answers. We have
it's
this
in the textbook kind of.
Yeah, of course. So all the problems of the shoulder with one protocol of the treatment. This is not good. Then I go to the university and I try to study more. I reach more answers, but always it was not complete what I wanted to know and what I wanted to hear.
You felt like something was missing.
Yeah, it was missing, and it was missing the most important kind of answer there. And then I come to the answer while I was studying more on osteopathy. I've done a lot of trainings, of course, on other kind of treatments. But osteopathy is that it gives you more answers with that. It gives you chills while you are working, while I'm telling you for the problems of the patient, because sometimes I'm very curious for the body. When I see a problem there, I want to know what is the problem. When I was with my friends drinking a coffee, and I see somebody there, it was doing like this, and it was doing some movements that I can read some answers from that movement, and I wanted to hear that fascia.
to find out a little bit more.
But I couldn't go there and to say, hey, I'm Mustafë, I have a clinic here near that road there, and come here, I want to. But sometimes it gives you some. I'm very curious for the body. I try to reach every knowledge that I see and kind of, but when you know something better and better, you know that you know so less. You don't know everything about body. I've seen a lot of beautiful and magical things that body can go through or can answer to or something like that. Well, I want to tell you something. If there's any problem in the body there, when the pain comes, the source of problem, it could start 10 years ago. But body told you 10 years later. That is interesting. Wait, why now? Or what happened else that you have to tell me that there is a pain there? So this is interesting. Because we are until now we talked only about some kind of pain that are in our joint and from mobility, lack of mobility, injuries and something like that. We have a lot of pain that comes from our emotional damage or traumas or something like that. Here in Kosovo, there's a lot of them because 20 years ago we had a war. We had a lot of traumas there and traumas again and again and again. So we have to try to understand every patient that comes in our clinic, and we have to be very, very clear in our mind that what that patient has and what that body tries to tell us, okay? Because sometimes the mouth of the patient tells everything else, but not the problem.
Oh,
so when we see
almost
that,
avoiding it.
yes,
Yeah.
when we see that, we have to stop hearing the patient, and we have to just start hearing the body, okay? Because the body is the machine that tells everything else, okay?
So are there, I guess in some instances then, can the pain or the perceived pain be very much psychosomatic? Like it's...
Yeah,
and it's actually then...
a lot of times. So you have to be very, very smart and to see all the decisions that you have to make through the treatment just to treat that patient, okay? So we have to be sometimes a kind of psychological, and sometimes we have to be friend. Sometimes we have to be like a family for the patient.
Sure.
Sometimes we have to be very serious and very strict, because that is the body is missing, okay? Some strict person in their life to tell them not this, or something like that.
Are there, and again, like going back to sort of the example you mentioned earlier, where you were asking this one patient to go get an ultrasound over stomach and internal organs, right? On that, I guess, when you feel that it's really trauma based, for example, then there are going to be maybe instances where you ask them, like, and that's probably a really difficult, even more of a difficult conversation when, the person came in thinking they will get a massage, and actually you ask them like, you need to go speak to someone because there is a lot of emotional kind of...
Osteopathy has a kind of treatment that you could treat the traumas, emotion traumas, okay? So we have to reach some kind of balances in the breathing exercise. We have to release some vagus nerve, phrenic nerve, that are very important nerves in our body.
Okay.
And vagus nerve is a very important nerve in the body that keeps a lot of information from the body to the brain. So we have to release that road of the nerve, so we could there reach an emotional release. That is very interesting to see.
Yeah, and
sometime
and
I will call you.
But it's one of those, I think probably it's becoming a bit more popularized is not the right word, but because a lot of breath work is becoming popular, right? With whether it's cold exposure as well and these kind of things, and it's about the vagus nerve kind of tapping into that, right?
Yes, but we have to be careful because every kind of breathing exercise is good for our body. Okay. But sometimes some people can be disappointed from the results of breathing exercise because their breathing work, it's not, it's not the most important for them, okay?
Okay.
They have to do something first, some kind of extra exercises, and then breathing work.
Right. Okay.
For example, let's say we have an pelvic floor muscles that are very tight. Okay. If you do breathing exercise for 2 weeks, you reach very not good results. Okay. But if you do first the releasing of these muscles that you can do with Kegel exercise, they are called. Okay. And then you do the breathing work, the results are more, more bigger,
enhanced,
and you can see them. Okay. For example, we have a patient, it comes out on our clinic and says, my fingers are tingling, okay? And the first thing that comes on our mind is if there's any entrapment of nerve or something like that, okay? But it can be just an disbalance from the breathing exercise on diaphragm, okay? And our skull and muscles here in the neck. If our diaphragm is not working good, okay, from a disbalance in our body here or in our abdomen, then it doesn't do all the work. So the second muscle and the third breathing muscles that are scalens, they have to work more and more and more.
Okay.
When they work something that they are not called to work, okay, then they reach some different
The level of stress as well, right?
tonus of muscle.
Yeah.
So, and it can press our nerves, and every
Excite
time,
us,
yes.
Okay.
And they say, oh, while I'm sleeping, when I wake up, my hands are tingling, or they are. I have to, yes, I have to move my hands. So the first thing that comes on our head, okay, we try release for 5 minutes our diaphragm, okay, then we release the muscles of skull and muscles, and we see there is a very big results, okay. That is a wow for the patient, okay, because he will say, oh, he works something here, and my hands are free, okay. We don't go and massage. I don't touch the hands, okay. Just we have to do some points of.
Whereas it is also possible at maybe a different clinic or so. It's like, all right, let's massage the arms and see what happens, kind of thing as well, right?
But I think all of us, all the community of physiotherapists are getting more information every day, okay? And I think and I hope that this will be a kind of assessment that we can do all, okay, because we can give everybody a good result.
And I think on that note, one thing I want to ask you in terms of like the current, let's say, physiotherapy landscape, if you can call that, in Kosovo, is sort of, you know, because you've seen it also evolve, it's continuing to evolve. And so I wanted to ask you, do you think that, you know, where do you see it going in the near future at least? And then the other thing is also, I think, regardless, and this applies to even, I think maybe probably some doctors are going to get upset with me, but also whether it's therapists or even trainers for that matter, sort of like it's almost unfair, and it may be also part an educational process for the person that like you shouldn't be subject to, oh, you need to get a massage for the rest of your life, right? Like that is not the way to go, right? And it's not also the way to go of like saying maybe a doctor's like, no, you cannot do this exercise anymore. Like that is also not, I think, the way to go, right? And then also I think on the trainer's part is like also, you know, that like to kind of work around the, you know, there's also some trainers I think that, you know, oh, like if they hear about lower back pain, then we're going to completely avoid it. We're not going to do anything and not try to address it, right?
Yes, of course. There is a phrase that we say to our patient: if a doctor says do not move because of your back pain, is the time to change the doctor.
Yes.
Okay. Because the movement is the key of the resolving problem. Okay. Let's all in one side. Movement is the reason why me and you are talking here. Okay. We just want to reach the movement. Sometimes we have to do sacrifice. For example, some patients have lack of movement and pain. For me, it's important to get the pain go away. But first, I have to release the movement, okay? And if a patient here has this movement this week and the other week and has pain, okay? And the other week has this movement and have pain, for me is a success. Because I reach the movement, the pain will go away. Because the structures there are reaching the 100% capacity. They are capable to do what for what they are there, okay? They work. So sometimes the king of the treatment is movement.
Yeah, and I think like that in terms of like for my approach would be sort of, well, assessing at the same time also establishing what is sort of the pain-free range of movement for that person, right? So again, context matters, where if I were working with someone that's going to play in the World Cup final, it's a once in a lifetime chance.
Yes.
You're not going to say no, kind of thing, right?
Of
But
course.
most of us, unfortunately, we're not playing fortunately, we're not playing in the World Cup final. So
Yeah.
then it's okay. It's not a sprint. It's more, let's look at this long term. Let's try to establish what is pain free. And if we can start to get a little bit of movement, then there's going to be blood flow. If there's blood flow or increased blood flow, then
Yeah.
the nutrients, and we can start to kind of look at, how things could possibly recover, right?
Yeah, of course.
Yeah.
Of course. We just have to look what is going on in the life of that client. If that is
Yeah.
very, very important for him or her to play there or to be there, okay, we have to sacrifice something, okay?
Yeah.
We have to see what we can do.
Mhm.
We have a lot of players that lost finals because their injury was very bad.
Yeah.
But in the other side, we have a player that the doctors, okay, more very big clubs, okay, say to the player, okay, we have to do this, okay, so you could play, but after the game you have to rest one month because there will be more injury there.
A consequence, right?
Yeah, a consequence. But
Yeah.
when we balance the consequence and our thinking of our possibility to win that final, okay, that could be more.
And it's a case by case kind of where
Of course,
there's going to be a
of
risk
course.
assessment. What are the
Yes.
pros? What are the cons?
Yeah.
Kind of thing. So in terms of sort of like, where this is, in terms of, I guess, the therapist like landscape in Kosovo, like how you see it going, and then it'd be great to sort of kind of slowly wrap things up where, again, your personal projects, like, so I don't know if it's okay to mention, like, obviously you are the therapist or the team part of the team
Yeah.
uh,
Doctors on national
for
team.
the Kosovo national football team, right?
Yeah.
So that's a huge project that you've taken on. I'm sure it's a huge honor as well.
Yeah.
So like where you see, your practice, as well as also like how the landscape in Kosovo is slowly changing for therapists, and like sort of like, yeah, what do you have in store for, like, the next, I guess, 6 to 12 months in terms of,
First of all,
because you're a very busy guy to begin with. So
Yeah. First of all, I want to say that physiotherapy here in Kosovo, from what I've seen, because me and my colleagues had a lot of training out of Kosovo, okay?
Mhm.
And what we see there, I think that the physiotherapy in Kosovo is one of the best physiotherapy in the Europe, okay? Not
Okay.
only in Balkans, but in Europe, okay?
Mhm.
We have persons, some physiotherapists and colleagues that they are doing a very, very, very good job, okay? Okay, and we are trying to share that knowledge in the national team of Kosovo and everywhere there. So I think every time there is something new,
Mhm.
because and the medical issue is that all your life you have to be a student. Okay, you have
Yeah.
to learn more. There is nobody that can say I know it all. Okay. Sometimes I go to some trainings that I did before, and I know that I will not learn something new from that kind of treatment, but I can learn something new from you because I will see you there, okay? And me and you will talk about a problem, okay? I can share something, you can share something, and this could be very good for me and for you, okay? Sharing, okay?
Yeah.
So the best thing here and everywhere is that if all of us can let something written about our work, so somebody else can reach and read and learn from our experience, me from other experiences, and something like that, okay?
Mhm.
So now I'm trying to do a PhD of physiotherapy. This is my future plans, okay?
Okay.
For now I'm very busy from some projects. I have to finish my master degree that is going now soon, and yes, I'm with national team and I have to be there for some games now they are coming. But my future plans are that I'm thinking and I'm trying to pick some countries that I can do a PhD on physiotherapy. This is something that I will hope so. Okay. And if more of us are doing PhD or something, we can go upper and upper on our physiotherapy.
Yeah, I think like certainly, and one of the themes of our conversation tonight has been about like collaboration, right? Like the more information can be exchanged, amongst therapists, amongst also just different health professionals, because, whether it's someone, myself and you, then it's like the problem might be the same, but we're looking at it from two different perspectives, right? And it's like, wait a minute, I'm looking at it from this side, and then, you're from the other angle, and then actually there might be something that we find out, because it's just the thought process is going to be different, right?
Yes,
so I think, it would, I mean, it's I guess it's interesting, and hopefully that is like an environment that is going to be cultivated, where I think people will feel more, and I'm not saying it's not the case, but like, the more people are willing to partner up, even if it is like from trainer to trainer, because my expertise, for example, is sort of, well, I have a number of expertises, but I know that certain people are much better at maybe the bodybuilding, for example, right? And so I certainly would like to learn from someone who knows bodybuilding inside and out versus, that person is a pure gymnast. So they also have probably something that I can certainly learn
different learning from.
And then a weightlifting to someone who's really mobility specialist to, I mean, there's just a million ways to go about it, right?
Of course. We have to be so smart so we can learn from everybody. It's a kind of treatments, it's a kind of word or something like that, but we learn when we talk to each other. We learn, so we have to do that. We have to collaborate with each other, and this is the best form to reach the best for the client or for the patient. This is
and I think it's going back to that sort of not losing sight that ultimately it's the person that we're working for, right? That is the center of attention, in terms of like, if that person is able to perform to their maximum capabilities, or becomes pain-free, or whatever the situation is,
whatever
right?
the goals of the patients are. And that is sometimes it's very a happiness moment when a patient comes to you and says, I didn't do this for like years, and now with your work here, I'm going through this kind of work that I didn't do before, or something like that. And you have two kind of clients that can make that difference in their body. But the main thing is not to look good, or the main thing is to feel good on our body. And sometimes I try to say my patients that if now you are good, you are pain-free, or if you say to your clients, now your body is looking good and you are feeling good, now you have to listen to your body. Because there's a time when the body says no for something. You have to hear that, and you have to respond to that answer or question from the body. I always try to teach my patients how are the best forms to hear our body. And I say to them sometimes, just you can sit there, and feel everything in your body. Sometimes a patient says to me, I had a pain in my knee, but I think I had this pain before 3 to 4 years or something like that. They don't even know exactly if there was a pain or there was an injury or something like that. They don't have time to hear their body.
This is in today's stressful, kind of fast-paced,
intensive work and something like that.
Yeah.
But we have to find some 2-3 minutes just to sit and talk to our body like it was another person, because it could tell us very, very, very important information for our health. So I think this is one of the most important, how to say, decisions for our body. If we try just to,
and it seems so obvious too, right?
Yeah.
But again, people, I mean, including myself, we're so caught up with sort of this fast pace. Okay, next thing,
Yeah,
and then
yeah.
actually we kind
I
of
see.
like forget that.
I see myself too from the work, but we have to, okay, or just I have to share this for my patient. If you can do, you can do. If you can't, it's a problem of yours now, okay.
Yeah.
But you have to tell them that they have to do.
Because it starts with you ultimately, right?
Of course. If you want to change something, change you first, then.
Yeah. Okay. One last question. Now, this is sort of just to wrap things up, because actually time flies. Okay. So, for some, and I know like you're already very busy, but for those who aren't familiar with your practice, where can they find you? What's the best way to kind of reach you, contact you, that kind of thing?
Yeah. This is not the kind of what I like to say, okay? But okay, if you, I'm in Fushe Kosovë.
Yeah.
The street name is Enver Maloko. There is my clinic. I'm there working with 13 other physiotherapists there. They work.
It's a pretty big team already. Yes, I've noticed that it's gotten bigger. So
we have teams for sport injuries, for treatment of pains in neck and lumbar, spine, and something like that are more how to say traditional problems on our clients, neurological problems, orthopedic problems, and sort of them. And from Monday to Friday, I'm here in Fushe Kosovë, and on Saturday, I'm in Istog in my new clinic there that I opened about 4 months ago. So I work from 9 a.m. to 7 p.m. And the main thing for me is to do a full body examination. Then if I can do that full body examination, we do a specific program for the problem and for the person or patient. And then when we do that for about I want to say the most of all, okay, we do some 5 to 6 therapies, okay, and
again, it depends on the person, right?
Yes, of course, but I'm telling with the percentage, with most of the percentage, okay, that if we do a good assessment, okay, full body examination, we reach all the answers from the body. I think that for kind of traditional problems on the body, 5 to 6 sessions of osteopathy, including physiotherapy and other kind of treatments, are enough for our body. Okay, if we do maintain our body, it's the other thing. Okay, or if we do another injury or something like that, it's another thing. But for a pain that is chronic or acute or something like that, we have to. It's a kind of that work that we do.
Okay. Amazing. Mustafë, I really appreciate you taking the time out of your busy schedule.
It was a pleasure being here with you.
Okay. Definitely would like to do this again another time if time allows.
Of course.
So everyone, that's another episode of It's Never the Right Time. Thank you for tuning in. This is 103.5 or 105.5 Urban FM. Thank you guys. See you soon.